It's just that I think they have a lot to do, too. So there's only so much they can do that way. That's why, but I think what's like nice in the VA is that we have these other things that are conduits for that, like primary care mental health. Like that doctor did that because he didn't have this team, and that primary care mental health team is made up of people from primary care and mental health. So the doctor says, the doctor's seeing people every half hour or whatever, and then he wants to make sure this is addressed, but he doesn't have time to do all that. But he says, hey, I have, so-and-so out here, I'd like you to go talk to her, and she's gonna tell you what we can, offer you to help with whatever the problem is. And that's a warm handoff, right?
Right.
Not a piece of paper that says, here's a referral to, whoever, follow up now. Because the thing is, when you do that,
people get lost.
That's right. They fall through the cracks.
Yeah. Okay. Do you have questions?
I do.
Go for it.
There's an organization in Marion Carbondale area called Disabled Veteran. Do you guys work with them in any way, or do you work with any other organizations?
Oh,
I know
yeah.
y'all are pretty big, but
Yeah. Oh, yeah, we do, like all the time. In fact, I'll give you an example of one. There was a veteran from Anna who died of an overdose after he discharged from our program. And his mother, his mother somehow got involved with, it's a motorcycle, it's a combat veterans motorcycle association is what it's called. And they did one of these motorcycle runs where they all, I don't know, I really promote it because I think they kind of go from
Bar to bar.
yeah.
Although this one, it looked like they went from VFW to VFW, which is a bar, but anyway, they raised like $2,500 or something like that, and his mother wanted to donate it to our program, and it was like a big deal, and it was on the news and everything, and the guy from the motorcycle club came to the VA, and the director met with him, and they handed him a big, one of those big checks and stuff like that. And then just on a lower scale, like the Ladies Auxiliary comes and does bingo in my program every month. There's tons of like interaction with veteran organizations. And I just hired a recreation therapist in my residential program who's a veteran himself and is super involved in veteran organizations. There's one called Red, White, and Blue, RWB is what they call it. And they're really involved in the community and getting veterans out in the nature and in sporting kind of things and kind of promoting that integration back into civilian life but still having that connection.
My friend, longtime neighbor, she works with veterans and dogs.
Does she work with Bahesha?
Maybe.
Is it over here, like in Carbondale?
It's
Disabled
Johnny
veteran?
Logan is who puts on the trainings or whatnot.
Well, we used to have a service. Well, he wasn't a service dog, but he was a therapeutic assistive therapy dog, Teddy, that lived in our program when we first opened. And Bahesha Doan, who runs Disabled Veteran. Have you heard of that?
Yeah, that's what.
That's
I was
it.
talking
Maybe that's
about,
it.
that one.
Okay.
Yeah, she trains service dogs, and veterans go through that program and get trained.
I think that the veteran actually trains the dog.
They do.
Okay, and she said it's extremely effective.
Oh yeah, it's good. It's a good program.
Yeah.
Yeah.
She said it's like this dramatic change in people's lives. It's just incredible.
And they train them, but they're trained by the trainers there. Like the vets come with the dog. In fact, we used to go out there with vets and do some of that with them whenever we first opened for the first couple of years.
Yeah.
Mm-hmm.
It was kind of related to a question about like how effective do you find that like the program is? Like, do you find that like veterans, do they really get better? Is it?
Oh
actually
yeah,
working?
Absolutely. Now what happens is, you're in treatment. We have a lot of measurement-based care, so we're doing we use all kinds of measurement tools,
Assessment.
like we use the BDI, the Beck's Depression Inventory, and every single week they're doing that. So if they come in with depression, we're getting their baseline score. By the time they leave, it's nowhere near what it was when they came in. We do a PCL for PTSD. We have something called the Brief Addiction Monitor for people with an addiction that we measure from the time they come in until they leave. We're measuring, are their symptoms getting better?
Yeah.
And the thing is, okay, that's while they're in the treatment program, right? The thing is, when they leave, looking at it. And we look at readmission rates. We look at their staying connected to outpatient or aftercare support and stuff like that. And I'd say that we're not, when it comes to specific things like PTSD that can't really compare, they definitely get better with evidence-based interventions. But with anything, recovery, again, is not a straight line. You don't start here and end here and now it's over and everything's cured. Especially if they start using substances again, that's going to make residual symptoms of PTSD come up, and they're going to probably have to come back and start working on both things again.
I didn't know that.
Yes,
Substance
that's true.
abuse
Oh yeah, will exacerbate symptoms.
of anxiety.
They think that it's
Reducing them.
right, but in reality it isn't. And it's also creating another problem because then their family members are worried. They may be messing up at their job. It's like all of this other stuff will happen. Now they didn't have just this problem of the PTSD symptoms. Now they have all this other relationship problems, So, yeah, definitely.
Will y'all take interns?
What?
Will you take interns?
We do take interns. Yeah, absolutely. In fact, I was just having to write about that this morning because I had to do my KSAs for my new position. We take interns. They have to go through the social work service program. I wrote about him. I had a combat veteran who was in the Army for like 15 years or something. He got out, he went through, and it's actually a really good program. They asked me to teach in it, but it's a virtual social work program through is it San Diego State or Southern California, something.
Yeah.
I think it's where I wanted to go actually because I grew up in San Diego. But he went through that program and actually they had like some kind of collaboration or relationship with SIU where he would do some of the stuff there.
Right.
And he came as an intern while he was in school getting his MSW, and I did supervision with him. And then he graduated. I had a position come open. He applied for it. I hired him into it. He was an MSW at that point. Then I did his clinical supervision. He sat for his exam, got his LCSW 2 years later, and then moved into my PTSD program, and now is a veteran providing, evidence-based therapy for veterans with PTSD. And I mean, he is just amazing. I mean, he's like really involved in alternative type, like he runs a mindfulness group. He's doing trauma-informed yoga. Yeah. And he looks like Jesse, kinda. Except he's got one of these beards that comes down to here that he keeps really well groomed and stuff. It's weird. And his head's shaved. Yeah. He doesn't really look like him.
He's a male.
It's just the beard. Anyway.
When you hire people, what do you look for?
I look for hungry, humble, smart. That is my philosophy on hiring people. And that means I want them to be hungry, meaning I want them to want to work hard. I want them to take initiative. I want them to be passionate, which I don't always necessarily get, but that's something that I am always. And so I look for that, I think, in other people. Humble means they know what they don't know. They can take constructive feedback. They realize that, it takes a whole team to make things work, not just them. And smart means, I don't mean book smart, I mean smart with people. Like,
EQ.
You know how to interact with people based on how those people present. I mean, one of the things I've had to learn as a supervisor, and I learned this actually through some leadership mentoring that we do as a team, and we filled out this thing called, I can't remember what it's called, a DISC profile is what it's called. And you answer all these questions, it takes a while, and then they give you this report back and they tell you basically your strengths and weaknesses and all this. And I was like flabbergasted at how accurate it was. Like I really was like, wow, this is describing me perfectly. And one of the things it said is that one of my weaknesses was that I don't provide enough, what did it say? basically I don't give enough pats on the back to people, right? Not that I'm negative either, I didn't say that, but it's that I don't, when people are doing a good job, I just kind of let them keep doing a good job. And the reason I'm like that is because I'm like that. It's nice to hear it, but I don't have to have that to do my job well and work hard. But what I realize is it doesn't matter if I'm that way or not. It matters if they are. And so I need to learn how to do it for those people, because that's what they thrive on, or that's what helps them feel connected and do better,
So have you done that?
What?
Have you done that?
Have I done what?
You worked on that.
Oh yeah, absolutely. And I do things that are like easier for me too, like, because sometimes I'm just so caught up in my busy job and what I'm doing. And as a supervisor, what you spend the most time on are the people who aren't doing their job right. So you just kind of appreciate the ones that do it, but then you also maybe neglect them sometimes. And so what I started doing is I meet with every one of my staff once a month. I meet with my coordinators twice a month, because they're kind of like, the interim supervisor when I'm not, they're kind of like in between me and my other employees. And I use that as an opportunity to tell them, give them positive feedback about things I'm seeing. I also use it as a time to look for opportunities for growth or change. And I'll write like little notes out. We have these things called eye care awards in the VA that if somebody does something that I think is above or beyond or is something that they need to be recognized for, I'll just print one of those out and give it to them in a staff meeting. Or just write a little note to somebody saying, I appreciate your integrity, or whatever. Just that simple thing. I remember when my boss, who's the chief of our service, gave me one of those, even though I'm not the kind of person that, I still have it to this day. And it's been years since she gave it to me. But even though I'm not the kind of person like that, it still really meant a lot to me. So that helped me change my view about it too. Because she's like me. She's not one of those people. She made an effort to do that for her employees, So, and even simply just saying thank you sometimes is enough, and all somebody needs, or good job, or wow, that was a difficult case and you handled it well. I remember my other boss, so the position I'm in now, it used to be where I was directly below the chief, and as one of the supervisors, the way the org chart was set up there. Our service grew so much and she was so busy that she requested to have an associate chief position, so one below her and between us, which I hated because I really liked having her as my supervisor. But we had somebody come in who's a psychologist. I didn't even apply for that because I was loving my job, and I still love my job, but I just was like, it was the time for me to try to do something new. And so anyway, he left. Now I'm in that position, so she's my boss again. So I like that. There was a reason I was telling that, which I just completely forgot.
Why do you like her as a boss? What is she doing well?
Well, what I like about her as a boss is she has a huge amount of integrity.
Okay.
And that's probably the biggest thing that I admire about her, and that she admires about me, actually, because that's what she said in the note she gave me. She works hard. She is all about patient care. Like, that is paramount. She wants to make sure that patient is taken care of, regardless if some policy or procedure doesn't get followed exactly the way it's supposed to be. She puts that at the top of, and then, there's this thing that we're doing right now in the VA called servant leadership, which I love. I love. If you ever do a leadership group or you're in a position, it's about, one of the things they talk about is upending the pyramid. So the way most leadership works that you look at is it's a pyramid, right? The leader is at the top and all the minions are below, right? And they say, you do this and you do this, and what they're talking about with servant leadership is that actually the leader is at the bottom supporting all of those people to be better at what they do. And that really is the way that I see, because that is the best way to get a patient taken care of, right? Because all of those people who are really hands-on with, I still do because I'm in the residential, but when I take this other position, my patient care is going to go I see those people every day, and I love it, and I do a group every week. I'm going to keep the group. I think I'm going to keep the group. I do a self-esteem group in there. But if you think about it, that makes way more sense to do it that way, you know? Did I go off the rails again? What'd you
No.
ask me?
I don't know.
No, I was asking like why do you like her as a boss?
Oh, the
What is
integrity
she
thing,
doing?
that patient care is
Right.
like, you know,
That's fine.
really important to her. We have, that's what I was gonna say, in the VA, this I care, like when I give out those awards, what that stands for is integrity, commitment, advocacy, respect, and excellence. And, you know, I think when it first came out, and I still think for a lot of people, they're just like, oh, I care. They're just, just another thing that they're doing. I used to be that way a little bit, and I really changed my, because I found it to be like a cynical kind of way of looking at things. And so I, for myself, just kind of turned that around and say, I really want to know what this means. And, you know, I want us to practice this. I think this is important, you know. And I started to sell that. You know, that's the job of a leader too, I think, is to get buy-in from people. So they don't just think it's another thing that the VA, that we're rolling out just to, because it looks good, but we're actually believing that this is important. And so the fact that she has integrity and commitment, and she is an example of that, I think is really important. And it's important for me to be an example of that too, in my position, so that it isn't just, you know, talk.
More paperwork, just
Huh?
not paperwork. Like not paperwork. I mean, it's a piece of paper.
Right.
Just not just something to show.
Right.
Yeah.
And I think that, you know, and I think that leadership within a facility has a lot to do with that too. Like executive leadership. So in a VA, you have a director. They're at the very top, right? The whole hospital, all of behavioral medicine, everything falls under that person.
And are they a doctor or are they
No, it's actually a nurse right now.
nurse? Okay.
But it could be a social worker. The Poplar Bluff, no, she's over behavioral health. Usually it's going to be a business
That's what I
person.
was gonna say.
And our last two were that.
Okay.
But she came from South Dakota. And then you have all the chiefs that fall under all the services. But they have a quad. So there's the chief, there's the director, and then there's what's called a quad. And there's a chief of staff who does have to be a doctor. And then you have a nurse executive who has to be a nurse. Then you have the associate director, which could be any discipline that falls under the director. And then, what's the last one? What am I missing? We fall under the chief of staff. And then there's the nurse executive. Oh no, the quad includes the director. So there's 3 people under her then. And then depending on what service you are, you will fall under one of those 3 people. We fall under the chief of staff, the doctor. And so my chief's boss is him.
Okay.
Okay.
And then she's my boss. So I'm like, 1, 2, 3 down from the director. And then I have like
Yeah.
17 people under me.
Wow. Busy.
It's going to be weird going to this associate chief position because I'm going to go from having 3 big programs and supervising 17 people to having 5 people and no programs. But everybody always says, well, essentially you have all of those programs because all of the people who supervise those programs, I supervise.
Yeah.
So if I don't like something they're doing in one of my programs, I'll be like, no, I won't do that.
So someone will take your position.
Yes, they will. But I'll get to pick that person, so, yeah. There's already several
And you will
people
look
who've
for
expressed.
hungry, humble, and smart people.
Yes, that's right. And I think that's important for people who are, you know, I don't know about this generation now, but, I mean, I hope that people think about those things when they want to get a job, because those are the things that are important to somebody who wants you to work for their organization. You know, you want somebody, and I don't mean, now, the thing is, and there's a book about this, I'll send you the name of it, but it's not called Hungry, Humble, Smart, but it's got the concepts in it. This was another leadership thing that I did for that. That's where I learned about it. And the thing is, if you have too much of one or the other, it's not good either. Or if you're hungry but you're not smart, you're going to be a problem for me. Because what that means is you're ambitious and that's your primary goal, is to just climb the ladder, and you don't care who you step on to get there, because you're not smart about relationships with people. And if you're not humble, that's a big, like you might be hungry and you might be smart, but you might not be humble.
Right.
Of course,
Then you have blind spots.
you know what I'm saying, right?
Warren Buffett has a very similar philosophy
Yeah.
in terms of who he hires. I think his are like, he wants people to be energetic, which is kind
Yes.
of hungry. He wants people to be smart, like what you said. And the other one was integritous.
What?
You have integrity,
Oh, absolutely.
which is kind of what you're saying with humble. And humble and hungry.
I mean, one of the questions I'll ask people who are within the VA applying, like sometimes we post jobs just to VA employees. And one of the questions I ask is, which one of the eye care values do you think is the most important and why? And I'll tell you, I'm usually looking for integrity, because personally I think everything falls from that. I had one guy who said excellence, and given his history, I knew why he didn't say integrity, because we all knew that he had done something that had a huge lack of integrity in it, and so he felt like he couldn't say that because he wasn't practicing it, So, you look for that, and you look for, because what happens is when you start to employ these concepts within your teams, the people, there's like, if you have a boat and you have, the people at the front, and they're like at the helm, they're making sure you go the right way and everything, and you got the people in the middle, they're the workers, they're rowing and everything, and then you got the people in the back that are just kind of